Ever wondered how renal dialysis works? Well, let's dive into it. Renal dialysis, in simple terms, is a life-saving treatment that mimics some of the functions of healthy kidneys. It's like having a personal, mini kidney outside of your body in the form of a machine. Just as our kidneys filter out waste, excess salts, and water from our blood to keep us healthy, this machine performs a similar job. But why is this necessary, you might ask? Well, there are some unfortunate situations where a person's kidneys may not be able to do their job effectively. Perhaps they've failed entirely, or maybe they're just not functioning as well as they should. That's where renal dialysis comes in, stepping up as a surrogate to keep the body's internal environment stable. So, now that we've got a basic understanding of what renal dialysis is, let's delve deeper. But why would someone need renal dialysis? The answer to this question takes us on a journey to the inner workings of our bodies. Our kidneys, often underappreciated, are invaluable players in our overall health. They serve as our body's natural filtration system, removing waste products and excess fluid from our bloodstream and balancing the levels of various minerals like potassium and sodium. Now imagine the impact on your body if this natural filtration system becomes impaired or shuts down completely. This is exactly what happens in kidney failure, a severe medical condition that can be caused by a variety of factors, including chronic diseases like diabetes and high blood pressure. In the case of diabetes, high blood sugar levels can damage the delicate structures within the kidneys, over time leading to a decline in their function. High blood pressure, on the other hand, exerts excessive strain on the blood vessels in the kidneys, causing them to weaken or harden, thus impeding their ability to filter blood effectively. When kidneys fail, they can no longer perform these crucial tasks. This is where renal dialysis comes into play. It acts as a stand-in for the kidneys, taking over their job of filtering waste products and excess fluid from the blood. By doing so, it helps maintain a stable balance of minerals and electrolytes in the bloodstream, a balance that is vital for the normal functioning of our bodies. While it's not a cure, renal dialysis can provide a lifeline for individuals with kidney failure. It can help them lead a more normal life while they await a kidney transplant, or if a transplant isn't possible for medical or other reasons. Renal dialysis is not without its challenges, but it's an essential tool in the fight against kidney disease. Without it, the buildup of waste products and fluids in the body would soon become life-threatening. In essence, renal dialysis becomes a life-sustaining process for those with kidney failure. So, how does this life-saving process work? Well, let's dive right in to understand the mechanics of renal dialysis. Renal dialysis is a treatment that does the work of your kidneys when they can't. It's a sophisticated process that involves pumping your blood into a machine called a dialyzer, often referred to as an artificial kidney. This machine then filters your blood, much like your kidneys would, before returning it to your body. Let's break it down a bit further. The dialyzer is a large canister filled with thousands of tiny fibers. These fibers act as the filters. When your blood enters the dialyzer, it flows around these fibers, creating a large surface area for the cleaning process. So what exactly does this cleaning process entail? Well, your blood, which carries waste, salt, and extra water that your body doesn't need, is run through the dialyzer. The walls of the fibers in the dialyzer are semi-permeable, meaning they allow certain things to pass through but not others. These walls allow waste products, excess salts, and extra water to pass out of your blood and into a special fluid called dialysate that surrounds the fibers. The dialysate is designed to draw these unwanted substances out of your blood without letting the things your body needs, like red and white blood cells, pass through. It's a bit like a bouncer at a nightclub, only letting certain people in and keeping the riffraff out. Except in this case, the riffraff are the waste and excess substances your body needs to get rid of. Once this filtering process is complete, the cleaned blood is then returned to your body. This entire process is usually performed 3 times a week, and each session lasts around 4 hours. But don't worry, during this time you can read, watch TV, or even sleep. It's also worth noting that the dialysis machine monitors the flow of your blood throughout the process, ensuring everything is running smoothly. It's like having a personal assistant, constantly keeping an eye on things for you. Now, you might be wondering, does it hurt? The answer is no. The process itself doesn't cause any pain. However, some people may feel a little nauseous or lightheaded after treatment, but remember, everyone is different and experiences may vary. That's the magic of renal dialysis. It's a complex process, but it's designed to keep you healthy when your kidneys can't. It's a testament to modern medicine's ability to replicate the functions of our own bodies and a lifeline for those in need. It's the perfect blend of science, technology, and the human body working together to ensure you can live your life to the fullest, even when your kidneys can't. Did you know there's more than one type of renal dialysis? That's right. The two main types are hemodialysis and peritoneal dialysis. Each of these has distinct processes, benefits, and drawbacks. Let's start with hemodialysis. This is probably what most people picture when they think of dialysis. In this process, a machine, often referred to as a dialyzer or artificial kidney, is used to clean the blood. The patient's blood is circulated through this machine, where waste products and excess fluids are removed. The cleaned blood is then returned to the patient's body. Hemodialysis is often performed at a dialysis center, usually 3 times a week, and each session can last around 4 hours. The benefit of this type is that it's typically administered by healthcare professionals, which can provide a certain level of comfort and assurance. However, the drawback is that it requires a significant time commitment and can somewhat limit a patient's flexibility and freedom. Now let's talk about peritoneal dialysis. This process uses the lining of the abdomen, or the peritoneum, as a natural filter to clean the blood. A cleansing solution called dialysate is infused into the patient's abdomen through a catheter. This solution absorbs waste and excess fluids from the blood, and after a few hours, it's drained out. This process is repeated several times a day. One major benefit of peritoneal dialysis is that it can be done at home, offering more flexibility and control over the treatment schedule. However, it requires a patient to be diligent and disciplined, as they'll be managing their own treatment. As you can see, both types of renal dialysis have their unique advantages and challenges. Hemodialysis offers professional oversight, but requires more time at a medical facility, while peritoneal dialysis offers more freedom but demands a higher level of personal responsibility. Choosing the right type of dialysis depends on a variety of factors, including lifestyle, personal preference, and health status. It's a decision that should be made in close consultation with healthcare providers, considering all aspects of the patient's life. Living with renal dialysis might sound daunting, but it doesn't have to be. Imagine the word dialysis not as a constraint, but as a lifeline, a new routine that allows you to continue living and enjoying the things you love. Let's debunk a common myth right away. Dialysis doesn't mean you're confined to your home or a medical facility. In fact, many people on dialysis continue to work, travel, and engage in their favorite activities. It's all about planning and making accommodations. Yes, you heard that right. Work and dialysis can coexist. Many dialysis patients continue to maintain their careers, sometimes adjusting their work hours to accommodate their dialysis schedule. Some even arrange their dialysis treatments around their work commitments. Employers are often understanding and supportive, and legal protections are in place to prevent discrimination. Travel might seem like a distant dream when you're on dialysis, but it's more than possible. Whether you're traveling for pleasure or work, arrangements can be made for you to receive your treatments at a dialysis center near your travel destination. There's a whole world out there waiting for you to explore, and dialysis shouldn't prevent you from seeing it. But what about physical activity? It's not only possible, but also highly recommended. Regular exercise can improve your overall health and well-being and can help to manage symptoms associated with kidney disease. Remember, it's important to discuss any new exercise regimen with your healthcare team to ensure it's safe and suitable for your personal circumstances. Living with dialysis also means embracing a new diet and fluid management. This can be a challenge, but it's a vital part of managing your health. A dietitian can provide guidance to help you navigate this new terrain, and many patients find that they quickly adapt to these changes. So while it's true that dialysis does require adjustments and compromises, it doesn't mean an end to the life you love. You can still work, travel, exercise, and enjoy your favorite activities. You can still lead a fulfilling and meaningful life. Renal dialysis might be a big part of your life, but it doesn't have to define it.